Hi, this is Dr. Lucas Brazil. I have the largest YouTube channel in the world about trichology with over 150 million views. In order to bring you information and tips about hair loss and care, aesthetics and health to the whole world, I created a version of the videos in English. Welcome and enjoy. Today's video will talk about the facial fillers. Facial fillers is used for the wrinkles, especially static wrinkles. Static wrinkles are those of the lower part of the face. Dynamic wrinkles are different. Dynamic wrinkles occur mainly at the top of the face and are caused by muscle contraction. The fillers are indicated for static wrinkles, which happen because of the loss of volume caused by age. There are several types of fillers and can be divided in temporary and permanent fillers. Temporary fillers are a safer substance, more accepted by the body. The permanent fillers, they end up staying in the body and do not always undergo excretion, and substance migration can happen too. One of the safest temporary fillers most approved for use worldwide is hyaluronic acid. Hyaluronic acid is very safe and not from rejection. It has no chance of allergic reaction as it is found in the human body already. It is a molecule specific for species and is the same in all animals. Hyaluronic acid is synthesized by bacteria and the laboratory. Nowadays, then the first fillers are made in a laboratory. They are made from bovine collagen or even hyaluronic acid from other animals, and it generates a lot of rejection. Now, as hyaluronic acid is synthesized by bacteria, it is practically pure and there is no reactions like allergic reactions. It has several types and according to the price, it varies a lot too. Generally, the most expensive are those that last longest and those that have the highest density. This happens because of a technique called cross-link. So with this technique, the acid becomes more compact, lasts longer, and it has a better quality. So the ones with lower density are used for more superficial wrinkles, for contouring the lips, and those with higher density are used for deeper parts and contouring the face. A lot of people confuse BOTOX with fillers. BOTOX acts on dynamic wrinkles, those wrinkles caused by the muscle contraction, and are indicated mainly in the upper region of the face. Fillers normally use anesthetic wrinkles like the Chinese moustache wrinkle. So they are totally different substances and with very different indications. There is no one that is better or worse, they are very different products. Hyaluronic acid is very safe because you know the whole chain of extraction. It will stay on the skin for more or less a half year, so it is there is very safe. When hyaluronic acid is inside the skin, it retains water, so it's making the skin more hydrated and stimulate quality for slow aging. After that time, the body starts to degrade hyaluronic acid into CO2, which is the carbon dioxide that normally exhaled, which does not cause any problem for the body, and water too. So it's a very safe substance and even during application does not bring any problem for you. Very interesting about fillers is that the person already leaves the office with a very nice appearance. The procedure basically consists of applying with a syringe and a needle, but it's a very small syringe and a very small needle too. Generally, the best quality products come with the anesthetic product that will relax and reduce no pain. If the person has a lot of sensitivity, your doctor can perform a topical anesthesia at the application sites. It usually goes very slow for you not see the result and not get too exaggerated. It's always interesting to do a little less, in this case, less is always more. This is very important to you to remember about that. It's better to correct less than to correct too much. The procedure is very easy and can be done at any time of the year. A special care after the procedure is that the small balls may remain. You pass the hand and you feel the filler in those regions. So with a good filler around 3, maximum 4 weeks or 1 month, it will undo these balls and it will be totally natural. Another problem that can happen is getting a little swollen, so you can put an ice there to help. Unlike BOTOX, the fillers can be massaged. When you massage that area, you spread in the filler and give it a more natural look. It's very important to remember that BOTOX you cannot massage, okay? If you watch the BOTOX video, you will see that if you massage, you can spread the BOTOX and have some problem with that. If you do both treatments in the same day, you can massage the fillers, but you can massage the BOTOX. And as for late complications, they can perform a granuloma, which is a ball of pus that the body creates. But in the modern filler, it's very hard to happen that. If an overfill occurs, there is an enzyme called HYALURONIDASE which can be applied and reduce the filler. So if the procedure is already super safe and you have any problems, then the application of the product will degrade the excess of hyaluronic acid and carbon dioxide and water. You don't need to be afraid of that. Subscribe to receive every week new videos, follow us on Instagram and Facebook, there's a lot of tips there. Would like to know more about our products? Check the description and click in our website eclairboard.com. Thanks for watching, here's Dr. Lucas Brazil, see you in the next videos.